Good morning, everyone, and namaste. And whenever I come on stage for Patients Union, I feel that I should never be on stage, but my team tells me as the founder I should say a few words. And as WHO's theme is hopeful future that cannot be without patients, that's first. And the genesis of Patients Union is very important. I've been into policy making for a long time. All I saw was, and this is very interesting to note, why our voice as patients should be the most forceful voice. I saw many organizations, at least last 10 years, a lot of new organizations have been formed. I don't want to take the names. They were all founded by same healthcare capitalists. And all of them speak the same language. To the government, it appears that this is what government should do, but it's actually the provider's voice. And that is not the voice that can do justice to healthcare. So what I said, and I was serving the advisor to health minister in my 3 years, 2016 to 2018, I didn't meet any single patient group. I met doctors associations, industry associations, pharma, medtech, nothing wrong in meeting and doing, but those whom we are supposed to serve, they were not in the room. So we said we should not just be part of the discourse, we should be creating the discourse. Policies are meant for patients, and they should be talking about themselves rather than we talking for them. And today we will have the opportunity of the top policymaker, Dr. Vinod Paul, member Health Niti Aayog, who kindly offered to say, I will come early and I'll stay and listen to every patient who speaks. So I hope he should be arriving any moment. But under the, I would say, the leadership of our Honorable Prime Minister, this government has done more than any other government in terms of health. We launched the largest insurance scheme, the largest digital mission, and more is coming. I think adding seniors to the list of insurers. And what you will see in the first session is patients talking. You will have patients right from a plumber to an office boy to top people. Health is not going to spare anyone if you are not delivering what they need. And then going on, you will see we are talking of things that people normally don't talk. So very few people will talk about what's the impact of long COVID. You see today videos of people collapsing at the age of 10, 12 and 20. It's become a common thing. So we said, we talked to our great friends who worked in AIMS and very senior doctors across the country that what is the problem? Is long COVID really impacting our health? Can we discuss and see what action government needs to take? So we'll discuss that. I think over time, quackery has taken a very different form as digital quackery. So we really don't know what is right, what is wrong, but we get influenced with it. As Patients Union, we're going to discuss that. But the best part, this is not a conference of people on the dais. Firstly, there will be patients, there will be policymakers in the room all throughout, and everyone is a speaker. You can just take the mic and share your views, and trust me, everything gets into policy notes for the government. That's our responsibility to take it to them. And lastly, I would say that we will also launch the first patients fellowship, our first cohort, because people should work with the patient to figure out what the healthcare system needs, not just big four consultancy firms coming and telling us what is needed and is it really going to work. Patients know best, so we should hear them out. And I think I'll not come between you and the start of the patient session. And I wish you all the best. Please stay engaged. Please give your inputs. Thank you so much for joining us.